Every now and again, customers complain of food poisoning. Then you find they've all eaten, say, the oysters. What do? Well, you take the oysters off the menu. Consider this then. You're a doctor. You know that 40 Australians a day are dying of something. You know that something is smoking. And you know it costs the community something like $1 billion a year in health bills. What do? Well, you try to have smoking banned. You can't. You try to have tobacco advertising stopped. You're only partially successful. So in the end, you do what one group of doctors has done. You mount a virtual guerrilla war against the big tobacco companies. These medical vigilantes and their cause are the subject of our cover story this Sunday, reported by Andrew Wally.
The surgery closed its doors hours ago, but duty calls these doctors out into the night. Faced with an epidemic for which conventional medicine has produced no cure, they've started an underground practice. Medical teams like this one are active in all our major cities. Highly trained men and women dispensing their own brand of preventative health care, doctoring billboards. Such operations are supposed to be life-preserving, but their handiwork is not always admired. Each of these doctors has been prosecuted for violating a billboard. Dr. Dean Southwood, ear, nose and throat specialist of Adelaide. Dr. Josephine Kavanagh, radiologist of Melbourne. Dr. Andrew Zenkowski, general practitioner of Newcastle. Dr. Arthur Chesterfield-Evans, general practitioner of Sydney. Unlikely shock troops in the war against smoking, prepared to fight a little dirty against overwhelming odds. Last year, the tobacco companies spent $60 million promoting their products in Australia, 100 times more than the New South Wales government could muster for anti-smoking propaganda. Philip Morris has pushed just its leading brand, Marlboro, to the tune of millions of dollars. A little corrective surgery has helped redress the balance.
These are some of the post-operative effects.
In a few months, Renee Batoon will be in Canada for a World Health Organization conference on smoking and health. She's been asked to convene a special session on public action. It's a pet subject. Some of her best friends are graffitists.
Just try and breathe in and out through your mouth as normally as you can, okay?
Ms. Batoon is a respiratory physiologist at Sydney's St Vincent's Hospital. When Philip Morris set out to find the Marlboro Man some 18 months ago, she mockingly entered one of her own patients, a man who can now only satisfy his cigarette habit by smoking through an artificial breathing hole inserted in his neck.
Big as you can. Put the tube into your mouth, close tight, and blow as hard as you can.
This is the real face of smoking. People with lung cancer, people with emphysema, people coming to me to assess whether they can tolerate anaesthetic, whether they can tolerate excision of a lung cancer, for example. If we take off half a lung, can they survive on the other half?
I'm going to close the doors. Okay.
What makes me particularly irate is that we have lots of very fancy-looking equipment that costs millions of dollars, computerised. It may seem to some people that there needs to be research in these particular diseases. What's the point in looking at the progress of a disease when prevention is the cure?
Oh, yeah.
Fine, okay, you can stop. Good.
I went to the pictures and seen them advertising on the pictures, the big shot smoking. I thought I was a big shot. Poor little bloody kids. They don't know no better at 13. You know that. And 12, you've got the kids, you should drum it into their heads. Now, tell them you've seen me.
John began smoking when he was a boy. Today, his lungs are crippled. Too late, he learned the two things may not be unrelated. John has advanced emphysema. Breathing is painfully difficult. Even mild exertion virtually impossible. The regular needles, which bring some temporary relief, are one of his few remaining pleasures.
You can't kill me when I'm dying, you know what I mean? You know that. And they've told me that in every hospital I've been in.
The sympathetic doctor, Arthur Chesterfield-Evans, would like to do a lot more.
While we have people absolutely dedicated to selling as many cigarettes, which produce the biggest health problem in Australia, we must bend our efforts to stop this by fair means or foul. The maximum penalty, in fact, under the Offences in Public Places Act for painting on a billboard is, in fact, $100.
It's radical fare for a medical dinner. And perhaps a little surprising that they should choose a guest speaker who's currently before the courts over a little matter concerning a cigarette hoarding. But when Arthur Chesterfield-Evans addressed some of his fellow doctors in Sydney last week, he got a good hearing.
November, I think it was. It needs the support of people like you who are respectable, more or less by definition.
In urging his colleagues to civil disobedience, Dr. Chesterfield-Evans revealed that in his time he had tampered with no fewer than 60 billboards. Of course, he was not able to discuss his present court case. However, evidence has already been heard that he told the arresting policeman, "It's illegal to deface a poster, but not illegal to push a drug to kill 43 people a day."
I did it because I believe it is right, and to anybody who says, "Why do you do it?" I answer, "Why do you not?"
It is not right to break the law to achieve your ends.
Is the AMA likely to move against those members, though?
No, well, I don't think that that it's our function to move against those members. This is a matter for the civil courts.
As federal president of the doctors' main professional body, Lindsay Thompson cannot endorse his more militant medics, nor can he ignore the AMA's own findings.
We've taken our statistics in Australia, which show that some 16,000 deaths per annum are related to cigarette smoking.
Is there any doubt that cigarette smoking is a major killer and a major debilitator in our society?
Absolutely no doubt whatsoever.
Mr. J. Gilmore, aged 43, report lumbar myelogram.
Dr. Josephine Kavanagh specialises in radiology, interpreting X-rays. They're often a sorry sight.
To represent an area of spread from the primary lung cancer to involve the spine. Stop. End of report. Patients presenting here with cancer of the lung are almost without exception cigarette smokers, would be over 95%. And this includes people in the younger age groups in their 40s and 50s. The same thing applies to patients presenting with blocked arteries. Almost every patient who comes here with signs of blocked arteries to the legs in the under 55 age group has a history of moderate to heavy cigarette smoking. Stop. End of report. Men in their 30s and 40s, almost without exception, the ones coming along with heart attacks at that age have been cigarette smokers. Upper esophagus, this incredible pageant of human suffering that you see here, much of it incurable, most in fact, is all completely unnecessary and preventable just by eliminating this single factor from their lifestyle. End of report.
Altogether, a depressing picture, which Dr. Kavanagh sometimes still carries when she leaves the office. One night, it got her into trouble.
I'd spent all day at work handling patients who were suffering from smoking-related diseases, and then come back to my own home, and right across the road is this enormous billboard advertising cigarettes. Hundreds of children passing it every day, designed to recruit new addicts into this terrible pathway in life. It just got too much for me. I just became so outraged I decided to take some action.
Well, what did you do?
Well, one night after the family was sound asleep in bed, I got an old kitchen chair and a box and a couple of spray cans and crept across the road and added a few health messages to the cigarette ad. I call it refacing rather than defacing. And I was just putting the finishing touches on when a police car suddenly arrived and appropriate action followed. I ended up in court. I was put on a good behaviour bond for a year and had to pay the cost of replacing the same terrible advertisement. Glad to say that unknown friends very quickly refaced that one too.
Well, I was incredibly unlucky. I was on the Pacific Highway, south of Swansea, that's south of Newcastle, and I drove past a Marlborough cowboy billboard, which I found particularly offensive. So I got out of my car and took out my spray can, rolled up a log so I could reach the billboard, and I was in the middle of writing the word poison on it, which I thought was a fair description of their product, when a Philip Morris representative happened to stop in his car, a chance of about 1,000,000 to 1, I'd say, and caught me in the middle of the act. And he was very excited, and we had a very heated discussion, which really came to nothing, but he obviously went off to the police. And next thing I knew, I was in court. Because of my previous good character and no previous record, I was fined $30 and no conviction was recorded.
5 doctors will have broken the law. At least some of them were found not guilty, and possibly myself. So in that case, they didn't. But nevertheless...
I understand their feelings. I do not agree with what they're doing. I don't believe they should be taking illegal action and defacing other people's products. I'd rather see us work to get legislation which would prevent the use of the billboards.
I felt the need to resort to this type of action almost purely through frustration with lack of significant efforts by state and federal government agencies to do anything about the tobacco problem.
Have you appealed personally to them?
I certainly have. I've written to the health ministers at a federal level and a state level on several occasions, and I've either been fobbed off with meaningless replies, or they haven't replied to me at all.
Well, this is a fairly standard sort of ad which...
In the privacy of his own rooms, another doctor is busily refacing cigarette ads.
Make this into
Hunter Fry is one of the country's foremost plastic surgeons. He also does reconstructive work on his patients' reading matter.
Because, of course, smokers do get a very dirty mouth.
How about stale as breath?
Well, I suppose it's a bit of fun and a bit of a challenge to change the meaning of these advertisements, which I don't approve of. But I think mostly I would like to see people in the waiting room being given the opportunity to think about these matters. The tobacco-related and tobacco-caused illnesses in our specialty anywhere from the lips, mouth, throat, larynx, and all the way down to the lungs. Cancer along that track. All of these people who are unfortunate enough to contract cancer in this situation are smokers. For instance, in lung cancer, I understand, I don't treat lung cancer, but I understand that it's 700 times more common in smokers. And in fact, carcinoma of the lung is now almost regarded as being a preventable disease.
He's been a heavy smoker for a long time. But the main trouble is this shadow over here on the left lower zone, which you can see in the lateral picture here as a round shadow in the back. So it's not a cut and open and shut case yet. We've just got to see how we get on when we get in there.
The cost of smoking in terms of treatment given and productivity lost is now thought to be well over $1 billion a year. But that huge sum disappears down a seemingly invisible drain. What governments see is the millions that flow into the public purse from tobacco sales. They're hooked on cigarettes. And vulnerable to the sort of intensive lobbying which recently blocked a bill, sponsored by a Perth doctor, for a wide-reaching ban on tobacco advertising. Money talks louder than the health experts.
He gave up smoking 10 years ago, as you probably know. But prior to that, he'd been smoking about 2 and 3 packets a day for over 30 years. And it's the total dose that's the problem, of course. And even though he's given up, he's got a very extensive carcinoma here, and at the moment it just doesn't look as though we're going to be able to cure it for him.
There are some powerful vested interests arrayed against you.
But I think we're winning. We're very pleased that the federal government in 1976 agreed to ban advertising on television.
Tobacco advertising is banned on television. But brand names still flit across our screens as the cigarette manufacturers proudly sponsor this artistic achievement or that sporting triumph.
See the action in the coming Benson & Hedges World Series Cup between
the generous tobacco sponsorships are cruelly enticing to hard-pressed administrators.
Brought to you by the Benson & Hedges Company.
It takes a determined man to hold out. Dean Southwood is such a man. The Adelaide ear, nose and throat surgeon is uncompromising in his stand against smoking. Except for emergencies, he refuses to operate on patients who smoke. One night last year, his loathing for the habit got the better of him. He scrawled his feelings across a cigarette hoarding.
Oh, I just wrote cancer on it fairly simply and initialed it bugger up, which you probably know as Billboard utilising graffitis against unhealthy products. The matter went to court and the case was dismissed by the judge on the recommendation of the police prosecutor, who also agreed with my lawyer that the whole thing was too trivial for words and should be dismissed.
There's nothing insignificant about Dr. Southwood's other contribution to the anti-smoking cause, a gift of $15,000 to allow his local cricket club to pass up tobacco sponsorship for 3 years. He's also guaranteed a loan of $75,000 for a new clubhouse, provided the cigarette companies continue to be shown the door.
The association with tobacco and sport is so cynical, really, promotion of their product through our sport, and it really gets me. Tobacco companies have found they can get hours of free advertising through the children's viewing hours. In Test cricket, for example, Benson Hedges, they get their name on the television and to the children 30,000 times in a test match or something. Absolutely incredible, in direct contravention to the spirit of the law.
And we did a survey last year, and we found that, analysing the rugby league finals, that there's some 14 minutes out of a total game of 90 minutes where the actual advertising of products is before the camera. So it's a very big method, and I think probably a cheap method of advertising for the promoters of tobacco products.
We tried to put a non-smoking sign on the Norwood Oval where the local football club plays, and although we had the right to advertise there like everybody else, pressure was put on and we had to reduce the sign of our non-smoking symbol to half the size of our club name, so that it was almost non-visible in comparison with the other signs around the Oval, which were Join the Escort Club or anyhow of a Winfield or whatever.
They seem to pitch it, of course, at youth, sporting figures and generally healthy outdoor types. And one of the things that greatly concerned me is a recent Sydney Morning Herald souvenir colour lift-out on the royal visit, where we have the Prince and Princess of Wales and Prince William. And, by the way, the Prince of Wales is the current president of the British Medical Association and has very strong views about the question of smoking. And underneath this you have Benson and Hedges, when only the best will do. You know, it is not in good taste allowing this sort of association, which I think is bad.
In fact, do you think that all forms of tobacco advertising should be banned?
Without a doubt, without a doubt. And I'm sure we're going to achieve it. It may take 5 years, it may take 10 years, but I've got no doubt that certainly by the turn of the century that the advertising of tobacco products will be banned in most sensible societies.
You're listening to Sydney Education Radio.
Arthur Chesterfield-Evans is one doctor who still questions our sense of priorities.
Did you hear the New South Wales Health Minister's press interview about the Taiwanese poisoned mushrooms? He said that he had ordered they be taken off the market. The interviewer asked, isn't that a drastic step? And Minister Burton said, no, they've killed 3 people. Well, 16,500 Australians died of cigarette-related illnesses last year. Doesn't that call for drastic action, Mr. Burton? All we're asking for is a ban on cigarette advertising.
I think we've given up waiting for the government to do anything, and I'm hoping other medicos are feeling the same. We've tried very hard for the last 3 years, and working through the government, we've achieved absolutely nothing.
In fact, the pressure has achieved something. All 4 Labor states are now phasing out tobacco advertising on public transport. But it's cosmetic surgery. Australians continue to puff their way through some 40 billion cigarettes a year, and some of their doctors are still fuming.
Well, I've got 16,000 reasons for feeling strongly, and that's how many people die each year in Australia from tobacco-related illnesses.
I think it should be an absolutely major focus of the whole medical profession, because as we said before, it's the major preventable cause.
Is there
of illness
still a place for direct action, do you think?
Well, of course, and I still, in my heart, of course, thoroughly support people who did what I who'd still do what I did. I thought it was right at the time, and I thoroughly support the many who've taken up the cudgel, so to speak.
I'm not heavily involved in it myself at the moment, but I have every sympathy for people who are. As there's in Oregon, they've almost wiped out Billboard advertising for cigarettes by graffiti on the billboards, and the tobacco companies don't put it up anymore. That's excellent.
Far be it from me to incite anybody to break the law, of course. I'm merely saying that I have, and I think until people do, the law will stand, and I think advertising is the key to the strength of the tobacco industry. I ask you to come and join the fight, because we will win, and the sooner we win, the more lives we will save. Thank you for your time.